This chapter includes symptoms, signs, abnormal results of clinical or other investigative procedures, and ill-defined conditions regarding which no diagnosis classifiable elsewhere is recorded. Signs and symptoms that point rather definitely to a given diagnosis have been assigned to a category in other chapters of the classification. In general, categories in this chapter include the less well-defined conditions and symptoms that, without the necessary study of the case to establish a final diagnosis, point perhaps equally to two or more diseases or to two or more systems of the body. Practically, all categories in the chapter could be designated not otherwise specified, unknown etiology, or transient. The alphabetical index should be consulted to determine which symptoms and signs are to be allocated here and which to other chapters. The residual subcategories number 8 are generally provided for other relevant symptoms that cannot be allocated elsewhere in the classification. Use of symptom codes. Codes that describe symptoms and signs are acceptable for reporting purposes when a related definitive diagnosis has not been established, confirmed by the provider.
The use of symptom codes with definitive diagnosis case. The codes for signs and symptoms may be reported in addition to a related definitive diagnosis when the sign or symptoms is not routinely associated with the diagnosis. As example, the various sign and symptom associated with a complex syndromes. The definitive diagnosis code should be sequenced before the symptom codes. The combination codes that includes symptoms. In ICD-10-CM, it contains a number of combination codes that identify both of the definitive diagnosis and common symptoms of that diagnosis. An additional code should not be assigned for the symptom when using one of these combination codes.
Assalamualaikum warahmatullahi wabarakatuh. My name is Siti Asha binti Muhammad and I will explain about coma scales and repeated fall. The coma scales code R40.2- can be used in conjunction with traumatic brain injury codes. These codes are primarily for use by trauma registries, but they may be used in any setting where this information is collected. The coma scales code should be sequenced after the diagnosis codes. This code, one from each subcategory, are needed to complete the scale. The 7 character indicates when the scale was recorded. The 7 characters should match for all 3 codes. Assigned codes are 40.24, which represent Glasgow Coma Scale total score, when only the total score is documented in the medical record and not the individual score. Do not report codes for a patient with a medically induced coma or a sedated patient. For the repeated falls, the first code is R29.6, which represents patient that recently fallen and the reason is being investigated. For the second code is code Z91.81, which represents patient that have history of falling and is at risk for future falls. And these both codes may be assigned together.
My name is Nurul Ain and I will explain about the code of SIRS due to a non-infectious process. Thus, we need to know what is SIRS. SIRS is systemic inflammatory response syndrome, which can develop as a result of a certain non-infectious disease process, such as trauma, malignant neoplasm, or pancreatitis. Let's go to the code part. If SIRS with a non-infectious condition and no subsequent infections are documented, first we need to assign the code for the underlying condition such as injury. Next, we followed by the code R65.10 systemic inflammatory response syndrome of non-infectious origin without acute organ dysfunction, or code R65.11 systemic inflammatory response syndrome of non-infectious origin with acute organ dysfunction. Next, if an associated acute organ dysfunction is documented, we need to code R65.11 systemic inflammatory response syndrome of non-infectious organ with acute organ dysfunction with additional appropriate code for the specific type of an organ dysfunction. And lastly, we need to query the provider if the acute organ dysfunction is associated with SIRS or due to another condition cannot be determined.
I will present about death not other specified and also an IHSS stroke scale. For death not other specified, it is used for death on arrival or brought in that patient, or which means that a patient who has already died that is brought into the emergency department or other healthcare facility and is pronounced dead upon arrival. So we need to assign the code R99, which is ill-defined and unknown cause of mortality, and this code does not represent the discharge disposition of death. Next is the NIHSS stroke scale. NIHSS stands for National Institutes of Health Stroke Scale, and it is a tool used for measuring neurological dysfunction. And the NIH stroke scale can be used in conjunction with acute stroke codes I63 to identify the patient's neurological status and the severity of the stroke. To assign the codes R29.7, first we must assign the code I63 for the type of cerebral infarction as the principal diagnosis. Then assign the code R29.7 as additional codes.